After losing weight, you might notice, no, you will notice more skin and more sagging. With body contouring, plastic surgeons are offering patients a way to maintain their ideal weight and also their image. Let's start with the stomach, which, doctor, we mentioned earlier, that is the toughest place to lose weight. Male, female, mostly men are always complaining, can't do anything about my stomach. So is that the toughest place to lose weight? End of story.
I would probably have to say yes. That's because that's the area that we move the least. We just eat and food gets there. So I think definitely that's probably one of the hardest parts to lose weight. And at the same time, your body wants to preserve, those central reserves. That's how we were designed. So our body will tend to have the preservation of the centripetal obesity and the fat patterns into the area of the belly and torso, which makes it much more difficult.
Okay, then what's the difference, and this is a great question I don't think people think about very often, what's the difference between fat held here and fat that's held in other parts of the body?
Well, one of the things that happens is when you're looking for fat centripetal obesity is usually associated with higher risk factors, with cardiac risk, diabetes, and other more comorbidities. So having someone who has centripetal obesity usually actually puts them at a higher risk for other complications. Sometimes people talk about what's called a metabolic syndrome, where you actually have a bigger waistline. But I think the most important thing, and also when we're talking about this, it's not the fat that's under your skin, it's the fat that it's under your abdomen, your internal visceral fat. So that visceral fat, if you have visceral fat, that is actually going to be the one that really puts you at a higher risk for all these complications. Because you can have people who have a big belly, but you touch their abdomen, and really you just feel like, oh, I feel the abdominal wall, I'm pure muscle. But the reality is they do have a significant amount of intra-abdominal fat.